As we continue our coverage of National Breast Cancer Awareness Month, we're learning about procedures that many survivors undergo. Dr. Heather King is here to talk about breast reconstruction surgery. Good morning, Dr. King. It's great to have you here.
Good morning.
You're with Texas Oncology,
yes.
And you are what you perform is oncoplasty. What is that exactly?
That is approaching breast cancer operations using a plastic surgery approach. So we pay particular attention to the placement of incisions and scarring, and we try to, in the setting of a lumpectomy, provide a normal or natural contour to the breast. And then in the setting of a mastectomy, we can do procedures where we can preserve the entire skin envelope, including the nipple, so that a reconstruction afterwards can be very natural.
Okay. What options do women have today in 2018?
Women have an endless number of options, and the good news is that now survival isn't really altered by those options. So when I meet a lady with breast cancer, we talk about, is a lumpectomy an option? Is mastectomy an option? Because we have to remove all the cancer when we do the operation. And then we can talk about pros and cons of both operations, and then it really doesn't change their survival. So a woman has a lot of choice when it comes to her breast cancer operation.
What are the pros and cons?
Well, with a lumpectomy, a woman's going to be able to preserve her natural breast. She will have sensation. And the main con is that most women with breast cancer who have a lumpectomy will require whole breast radiation afterwards. For women who choose mastectomy, a lot of times they choose it because of symmetry operations, or they want to avoid radiation, or in the setting of precancer, they may be able to avoid taking medications to prevent the recurrence of disease.
In your experience speaking with patients, how difficult is it for someone to make this decision?
I think the knee-jerk reaction when they come into the office is cut my breasts off. And I tell them, no, slow down. Let's do workup. Let's make sure nothing's going on the other side. And let's think about what you're going to want to feel like in the future. What's important to you? How do you want to look in a dress, in a bathing suit? How do you want to look when you don't have clothes on? What's important to you with your partner? And then we need to come back and backtrack and make sure we're going to do the right operation for the cancer, and then make sure we're going to do the right operation for the future when the cancer is gone.
And last, what's your suggestion to viewers out there right now who may be going through this time in their life?
Find a surgeon that you have a good relationship with who listens to you. Find someone who has specialty training and can offer you the most advanced surgical options, so that you know that you're getting the best oncology care, and then you also can have the best aesthetic outcome.
Yeah, it's all a personal choice, and such a difficult time for everybody.
Yes.
Thank you so much, Dr. King. We appreciate your time.
Thank you for having me.